Hey guys, it's Patrice Adeline from BeautyTimeRN.com. I'm a registered nurse and I specialize in plastic surgery and aesthetics. Every day I help women pick out the implant size that is right for them. And I've also had a breast augmentation myself. So by the end of this video, you will have all the tools that you need to pick out the right implant size for you. The first thing you're going to want to do is effectively communicate with your plastic surgeon about your goals and your expectations. Your goals and expectations might be to have more cleavage, look better in your clothes, restore volume that was lost, and your surgeon will be able to guide you to the right implant size just based on what your goals and expectations are, but also your body frame. You may be petite, you may be tall, you may be athletic, you may be curvy, and you will also be able to pick the kind of implant you want. You want silicone, you want saline, those will all go into the total consideration on the implant size. So the second thing you're going to want to do is bring in visuals for your surgeon to see at your consultation. That way you're letting them know what your expectations and goals are from the very beginning. So the way you want to do this is go online, look at different celebrities, look at different websites, maybe it's the surgeon's website or a different website that has before and afters. But the most important thing to do when you are doing this is finding people that have a similar body frame and also a similar breast size to begin with and a similar breast size that you want to end with. It's okay if you bring in pictures that maybe aren't exactly what you want to end with, because that will also help letting the surgeon know, like, I don't want them too close or too far away or too high, whatever it is. That's okay too, but it's also really important to bring in pictures of before and afters with somebody that is your size. One thing to remember to consider when you are looking for pictures is whether it says if it's under or over the muscle. That can impact the way an implant looks. I often have patients ask me why over the muscle looks bigger, and it's not that the size is bigger, it's just because in my theory, since it's over the muscle, there is just tissue and skin over it, so you're getting more of a cleavage as opposed to if you're going under the muscle. Since the muscle is kind of sloping over the implant, you're getting a nice, more natural transition, and I just think that makes the size look a little bit smaller even though it may not be. So the fourth thing that you need to take into consideration is that you can't just go in and ask for a bra size. People will often come in and they'll say, I want to be in the C range. Well, it's not really how it works. Just because your bra size can vary based on the size around your bust, what kind of implant you're getting. Are you getting high implants, low implants? It can vary on where you shop. It can vary on your chest wall. Like, there's just different ways that your bra size can vary. I know if you shop at Victoria's Secret, your bra size may be a little higher versus if you shop somewhere else. So I just don't think that bra size is a good correlation between cc's, which is what surgeons use to pick your size. So sometimes a good correlation is 200 cc's may equal about a cup size. So if you're getting 200 cc implant, you might go up a cup size. Now, this obviously is not a perfect system at all. If a very petite, small person comes in and gets 200 cc's, maybe they'll go up 1 cup size, maybe they'll go up 1.5 cup sizes. If someone who has a different body type comes in and gets 200 cc's, it's gonna be different. So it's not a perfect way to look at it, but it might be a starting point when you're trying to learn the difference between bra size and cup size. So the fifth and most important thing to consider is your surgeon's input. Obviously, they're the one performing the surgery, they're the ones with experience, and they're the one who is going to be able to look at your breast anatomy and pick the right implant size for you. If you pick an implant that is too small, it may not fill the breast pocket as much, and you may be unsatisfied if you pick one that's too big. It might cause complications. You might be at higher risk for having droopiness, stretched skin, maybe possible revision in the future. So it's important to kind of listen to your surgeon and find that sweet spot that fits with your anatomy. One thing to consider is if you are picking a breast implant that is bigger, since your diameter of your breast is a certain size, surgeons don't want to go past that pocket and give you undesired results. So you're going to be looking at a higher projection implant, which means they're coming out this way more. Implant that's lower projection will come out this way more, so you'll have more of a side boob, more cleavage in the middle, but it has to fit within the diameter you already have. So that's important to consider. So those were the 5 main points I wanted to share with you. Just a few final tips that might be helpful are if you are stuck picking between, let's say, $350 and $375, don't lose sleep over that. It's such a small difference. That's less than 2 tablespoons, and it's not going to look different in your shirt. If you are between, let's say, $350 and $375, I suggest you go with the $375. I've never seen anyone say they've went too big, and it's because of the way we do our consultations. We are really able to nail what the patient's goals and expectations are and get them to a good implant size. So it's up to them if they want to go, 25 cc's more, but it's just such a small difference that just don't lose sleep over that. If you are between the two, go with the slightly bigger one. People don't regret going bigger, but sometimes people do say, oh, I could have gone slightly bigger. But in the end, you're going to be happy with what you have. You're going to have an enhancement of what you have. So just don't lose sleep over that. One point I did want to mention is if you do have 2 different breast sizes to begin with, I think that it's important that the surgeon removes tissue rather than pick 2 different sized implants. Now, I'm not a surgeon, but I just think that picking 2 different size implants, the 2 implants might have different diameters, so they're going to be, different sizes that way, or if they're different sizes, they're going to have different projection. I just think it's weird to have 2 different implants in there, versus if the surgeon is skilled and if this is the way they like to do it, it might be easier to just have them remove tissue from one breast and put in the same kind of implants. Thank you for watching my video. Please go to my website for more information on this topic and other cosmetic procedures. Please follow me on Instagram, Twitter, and Facebook. And if you found this video helpful, please like, share, and comment below with any questions that I didn't answer or any additional topics that you'd like me to cover in the future.